Welcome back and thanks for staying with us. In this evening's health report, Shemala Pullen looks at phlegm.
Phlegm is another name for mucus. It may be caused by mucus draining from the nose and sinuses, thick saliva from dehydration, acid reflux, or mucus coming from the lungs.
Sometimes patients will also have early morning hoarseness. They may have a mild sore throat, and they may have a cough which doesn't seem to settle and worse in the mornings. The fourth source of phlegm in the back of the throat is actually from the lungs. But typically to get it in the back of the throat, you have to cough it up. And this is usually seen in patients who are chronic smokers and have COPD or asthmatics. So those are the main sources of phlegm in the back of the throat. And what you do is that you make your careful observation about the timing of the phlegm.
If untreated, it may cause throat irritation, poor sleep, voice changes, persistent cough, or worsening asthma and COPD symptoms.
If you have phlegm in the back of the throat, there are usually 4 potential sources for this phlegm. One source is that it could be coming from your nose and sinuses and draining down into the back of the throat. And typically, if this is the source, patients would often have nasal stuffiness. Sometimes they have a runny nose as well, and they may notice that they have pressure in the mid portion of the face, and they literally have to pull the mucus or phlegm down for it to get into the back of the throat.
Treatment depends on the cause.
Measures that you can use at home initially, however, increase your water intake. If you think it's coming from your nose and sinuses, then you can use saline nasal sprays and rinses to irrigate the nose to thin out the mucus so you get less phlegm. If you think it's maybe coming from the stomach, avoid eating within 3 hours of when you go to lay down so that your chances for acid reflux would be less, and you can take a nighttime antacid as well. And if you do have a cough, if you're asthmatic, if you have COPD, make sure that you're taking your prescribed medications for those conditions.
See a doctor if the phlegm lasts for weeks, contains blood, or comes with fever, chest pain, shortness of breath, or weight loss. With your health report, I'm Shemala Pullen, wishing you good health.